So now we're going to start the pterygopalatine fossa and its contents. See, pterygo means it is a part of sphenoid bone. So this fossa is also known as sphenopalatine fossa. Okay. Now, how to reach this fossa, sir? Now see the diagram. Now this is the side view of the skull. Now in the side view of the skull, we are seeing the maxilla bone. I am writing as M. There is a maxilla bone, and this is sphenoid bone. The pterygoid plate of the sphenoid bone. I am writing as P. P means the pterygoid plate of the sphenoid bone. Now between these two, we are seeing one elongated gap. I told you any elongated gaps are called not foramens, fissure. Fissure means elongated gaps. So now we have a fissure between the maxilla bone and the pterygoid plate, and the one which we draw a dotted line now, can you see that? That is our pterygomaxillary fissure. That is our pterygomaxillary fissure. Okay. Now the point is, now we remove the ramus of mandible and we are seeing this fossa here. That is our infratemporal fossa. I hope you remember that. So now you are in the infratemporal fossa and you enter the pterygomaxillary fissure. If you go inside the pterygomaxillary fissure, then you will be reaching the sphenopalatine fossa. Is that clear? So the point is, infratemporal fossa communicates with sphenopalatine fossa. Communicates with sphenopalatine fossa via pterygomaxillary fissure. Via pterygomaxillary fissure. Okay? Yes. Shall we proceed? So infratemporal fossa. From the infratemporal fossa, if you go inside the pterygomaxillary fissure, then you will be reaching the pterygopalatine fossa or sphenopalatine fossa. Right. Now I am putting some dots, the yellow color dots. Now that is the space inside the pterygomaxillary fissure. That is our sphenopalatine fossa. Then inside, we are also seeing one more foramen here. Can you see that? Yes. And that is a foramen present between the sphenoid bone and the palatine bone. And that is called sphenopalatine foramen. Sphenopalatine foramen. Okay. Now sphenopalatine fossa via sphenopalatine foramen. If you go inside the sphenopalatine foramen, then you will be reaching the nasal cavity, lateral wall of nasal cavity. Okay. So sphenopalatine fossa via sphenopalatine foramen, which communicates with nasal cavity, lateral wall of nasal cavity. So now we have a connection from the nose, from the lateral wall of nose to the sphenopalatine fossa. So any cancer from the nasal cavity, that cancer will come to sphenopalatine fossa via sphenopalatine foramen. Now from the sphenopalatine foramen, the cancer will come to infratemporal fossa via pterygomaxillary fissure. Okay. So this is a basic idea about this pterygopalatine fossa. And now we see the boundaries, actual boundary. Now we're going to enter the pterygomaxillary fissure. Now see the diagram. This is the close-up image. Okay. And this is our first. See the diagram, understand the diagram. Okay. Now this is the zygomatic arch. This is our zygomatic arch. Okay. And this is a maxilla bone. And this is the sphenoid bone. And the sphenoid bone is giving the pterygoid process. Now from the pterygoid process, we have two pterygoid plates, lateral and medial pterygoid plate. And can you see this gap? I am drawing this gap in the yellow color. Now can you see this gap? Yes, that is our pterygomaxillary fissure. Between pterygoid plate and maxillary bone, pterygomaxillary fissure. Then if you go inside pterygomaxillary fissure, then we are seeing the pterygopalatine fossa. I hope now you got some idea about the location of this fossa. Okay. Right. Now this is front side, anterior. This is front side. And this is back side, posterior. In relation to fossa, I am saying. Okay. Now, what is the boundary for the pterygopalatine fossa? Anteriorly, we have one bone. Which bone? Maxilla bone. So, anteriorly, maxilla bone. Very good. Posteriorly, the pterygoid process. Posteriorly, pterygoid process. Okay. Above, sphenoid bone. Above, sphenoid bone. Now, what is the medial boundary? Medial boundary, see this bone. I am marking this bone as P. There is a palatine bone. So medially, we have the perpendicular plate of the palatine bone. Medially, palatine bone. Okay, right. And laterally, we have the fissure. What fissure? Pterygo maxillary fissure. Pterygo maxillary fissure. Okay, right. So this is the boundary for the pterygopalatine fossa, spinopalatine fossa, the fossa between the sphenoid bone and the palatine bone. Okay, right. Now we're going to write the communications of the pterygopalatine fossa. Now what are the areas it communicates? Now we're going to draw some line diagram. Now this is our fossa, pterygopalatine fossa we are drawing. So to demonstrate all the walls, we are drawing the two boxes. I'm going to connect. Okay. So now this is the roof. This is floor. We're going to use, this is anterior side. So this is anterior wall. And this is posterior wall. And this is medial wall. We remove the lateral wall. Okay, in the lateral wall, I told you, laterally we have pterygomaxillary fissure. Yes. Now these are the, yes, the walls of the pterygopalatine fossa. Fine. Now, medially, I told you we have one foramen. Through that foramen, the pterygopalatine fossa or spinopalatine fossa communicates with nasal cavity. So medially, in the medial wall, we have spinopalatine foramen. Medially, we have spinopalatine foramen. I'm writing as SPF. We write the abbreviation here. So communications, please write the heading, communications. Communications, the pterygopalatine fossa. So communications, so medially, we have one foramen. What foramen? Spinopalatine foramen. Spinopalatine foramen. Now through this foramen, it communicates with nasal cavity. Communicates with nasal cavity. Okay, fine. Next one. Number 2. In the roof, we have orbit. So we have one fissure. Now that is our inferior orbital fissure. That is our inferior orbital fissure. So inferior orbital fissure communicates the pterygopalatine fossa and the orbit. So roof, we have inferior orbital fissure. Inferior orbital fissure. Now by this fissure, it communicates with orbit. Fine. Now in the posterior wall, we have 3 foramens. Now I'm going to mark, this is 1, this is 2, and this is 3. So posteriorly, we have 3 openings. The one which we marked as number 1, no, that is our foramen rotundum. And number 2 is the pterygoid canal. And number 3, pharyngeal canal. Now through these openings, the pterygopalatine fossa communicates with the cranial cavity. Communicates with the cranial cavity. Okay. Right. Now in the floor, we have the palatine canal. In the floor, we have the palatine canal. So in the floor, we have the palatine canal. Now by this, it communicates with the oral cavity. Okay, right. These are the communications we have. And lateral communication already we know. Laterally we have fissure. What fissure? Pterygomaxillary fissure. Laterally we have pterygomaxillary fissure. And by this fissure, which communicates with infratemporal fossa. Infratemporal fossa. Okay, right. These are the various communications. See, you have to know these communications. So if you know this communication, then easily you can trace the tumor the angiofibroma. Angiofibroma is a tumor arising at the sphenopalatine foramen. So from the nasal cavity, it can come to pterygopalatine fossa. From it can come to infratemporal fossa. It can go intracranially via foramen rotundum, pterygoid canal, pharyngeal canal. So we have various communications. So if you know these communications, yes, then the tracing of angiofibroma will be very easy. Okay, right. Now one more thing I want to say now itself, the maxillary artery. See, maxillary artery, we know the terminal branch of external carotid. Now, maxillary artery have three parts. See, we're going to discuss the maxillary artery in detail after the maxillary nerve. So don't worry. So the point is, we have three parts of maxillary artery. The third part of maxillary artery is present in the pterygopalatine fossa. Now, this is our third part of maxillary artery. Okay. So the artery which I am drawing here, there is a third part of maxillary. Now, third part of maxillary artery gives 6 branches. Again, it's not that much difficult. If you know these communications, then easily you can write the name of these branches. Now, the third part of maxillary artery give one branch, and that branch will pass us through sphenopalatine foramen. That branch will pass us through sphenopalatine foramen. And what is the name of the branch? That branch passes through sphenopalatine foramen. The name of the artery? Sphenopalatine artery. And the maxillary artery third part give one branch. That branch passes through inferior orbital fissure. That is called infraorbital artery. Very good. And the artery passes through pterygoid canal. Artery to pterygoid canal. Artery passes through pharyngeal canal. Pharyngeal artery. And the artery passes through the palatine canal. Greater palatine artery. So this is A, this is B, this is C, this is D, this is C. And one more artery we have, that is posterior superior alveolar artery. Again, we see that branch later, don't worry. So now A is our sphenopalatine artery. B is our infraorbital artery. C is our artery to pterygoid canal. And D is our pharyngeal artery. And E is our greater palatine artery. Okay, right. Again, we write these branches later, don't worry. So the point is, if you know the communications, easily you can remember the branches from the third part of maxillary artery. That is the point. Okay. Now we're going to see the animation for the pterygopalatine fossa. Now we're going to rotate the skull. So now we're going to see the lateral view. Right. Now we're going to zoom this area. Now this bone, that is the palatine bone. Okay. And this bone, that is the sphenoid bone. This is sphenoid bone. And this is palatine bone. Okay. Palatine bone and the sphenoid bone. Now between these two bones, yes, now we are having the space inside. See, my hand is going inside the space. That is the pterygopalatine fossa. Okay. Now in the pterygopalatine fossa, yes, now we are seeing one communication there. Many communications. Now this communication, what I am showing there, that is the sphenopalatine foramen. So sphenopalatine foramen communicates the pterygopalatine fossa to the nasal cavity. Okay. Right. So now we're going to turn the bone slightly in the front side, and we are seeing this foramen. See this foramen? That is our pterygoid canal, communicating the pterygopalatine fossa to the middle cranial fossa. Intracranial communication of pterygopalatine fossa. Just above that, yes, you are seeing this one. That is our foramen rotundum. Foramen rotundum, and this is our pterygoid canal. Okay. Right. So now we're going to remove the palatine bone so that you can see the communication of pterygopalatine fossa to the nasal cavity. So lateral wall of nasal cavity is communicating with our pterygopalatine fossa through the sphenopalatine foramen. And you are seeing the foramen there. This is foramen rotundum, and just below that you are seeing another foramen, that is our pterygoid canal. So again, we are seeing the two foramens, our pterygoid canal, and just above that is our foramen rotundum. Now these are some basic ideas about the pterygopalatine fossa. So pterygopalatine fossa communicating with nasal cavity through sphenopalatine foramen. Pterygopalatine fossa intracranially communicating by these two foramens, foramen rotundum and pterygoid canal you are seeing. Okay, yes, these are some basics you have to know about our pterygopalatine fossa. Right, now contents. Now we're going to discuss the three contents here: maxillary nerve, maxillary artery, and we're going to discuss one more ganglion. That is our pterygopalatine ganglion or spinopalatine ganglion. Pterygopalatine and or the spinopalatine ganglion. The pterygopalatine ganglion, spinopalatine ganglion, we're going to discuss along with the maxillary nerve. Okay, so we're going to discuss, yes, these three structures in this fossa. Okay, right. Now first we see the maxillary nerve. So now we're going to start the discussion about the maxillary nerve. So first we draw some line diagram and then we can see this actual image. So now maxillary nerve. So now maxillary nerve, we know some basic points. It is coming from the trigeminal ganglion. It is a sensory nerve. Now this is the sensory root of trigeminal nerve. The sensory root of trigeminal nerve expands to form trigeminal ganglion. And the trigeminal ganglion is giving three branch: ophthalmic, maxillary, and mandibular. Yes, I told you in the mandibular nerve discussion itself. So this is our ophthalmic nerve. So this is maxillary nerve. And this is mandibular nerve. Fine. So now the maxillary nerve, after the arising from the trigeminal ganglion, the maxillary nerve is, please remember, previously it was told the maxillary nerve is passing in the lateral wall of the cavernous sinus. But now they are saying maxillary nerve is not running in the lateral wall. Now this is a cavernous sinus. So the maxillary nerve, I'm writing as maxillon here. Now this is our cavernous sinus. So cavernous sinus, this is a lateral wall of the cavernous sinus. Okay. So this is our cavernous sinus. Previously it was told the maxillary nerve is running in the lateral wall. Like this is a lateral wall. In 2016, yes, in the 41st edition Grace, they made a change and they told that maxillary nerve is not running in the lateral wall of the cavernous sinus. That is the point. Okay, so maxillary nerve is not running in the lateral wall of the cavernous sinus. That is the point. Okay, right. And the maxillary nerve leaves the cranial cavity through foramen rotundum. That is our foramen rotundum. Okay, so maxillary nerve, after arising from the ganglion, the nerve is not running in the lateral wall. Almost it is in the floor of the cavernous sinus, and the maxillary nerve leaves the cranial cavity through foramen rotundum. Okay, and after passing through foramen rotundum, the maxillary nerve is entering one fossa here, and that fossa is our pterygopalatine fossa. So this is our pterygopalatine fossa, this one. Okay, so foramen rotundum, yes, that is the junction between the cranial cavity and the pterygopalatine fossa. So maxillary nerve passes through foramen rotundum and the maxillary nerve enters the pterygopalatine fossa. Now in the pterygopalatine fossa, the maxillary nerve is suspending one ganglion. That is our pterygopalatine ganglion. That is our pterygopalatine ganglion or spinopalatine ganglion. Pterygopalatine ganglion or spinopalatine ganglion is the parasympathetic ganglion. And one more point I want to add, that is the largest parasympathetic ganglion. Largest parasympathetic ganglion. Parasympathetic ganglion, I told you we have only four: OT ganglion, submandibular ganglion, pterygopalatine ganglion, and ciliary ganglion. Out of the four, yes, spinopalatine ganglion is the largest parasympathetic ganglion. Right. Then the maxillary nerve, after passing in the pterygopalatine fossa, the nerve passes through inferior orbital fissure like this. That is our inferior orbital fissure. Okay. So maxillary nerve, it leaves the pterygopalatine fossa and enters the orbit via inferior orbital fissure. Now in the orbit, the maxillary nerve is passing in the canal, in the floor of the orbit. Now this is the maxillary nerve. The maxillary nerve is passing in the infraorbital canal. The one which I am shading in yellow color, that is the canal, infraorbital canal. Okay. So now after passing through the infraorbital fissure, then the maxillary nerve will change the name to infraorbital nerve. So this is our infraorbital nerve. So infraorbital nerve, which is passing in the infraorbital canal. Infraorbital canal. Now, infraorbital canal is in the floor of the orbit. Infraorbital canal is in the floor of the orbit. Okay, floor of the orbit. Right. And then the maxillary nerve will come out of the orbit through the infraorbital foramen. That is our infraorbital foramen. Infraorbital foramen. Okay. After coming out of infraorbital foramen, the maxillary nerve, which gives the three terminal branches. One to the lower eyelid, palpable branch, and to the nose, nasal branch, and to the upper lip, labial branch. The terminal branches. So maxillary nerve, after coming out of infraorbital foramen, which gives three terminal branches, one to the lower eyelid, palpable branch, nasal branch, and the labial branch to the upper lip. Okay, right. Now this is the course of the maxillary nerve. Okay, and now we're going to add branches. The maxillary nerve, which gives meningeal branch, before passes through foramen rotundum, which gives a meningeal branch. I'm drawing this branch, and that is the meningeal branch. Okay, right. And while passing in the pterygopalatine fossa, it gives two branches. Now again, I will erase all this so that we get some space. So while passing inside the pterygopalatine fossa, it gives two branches. Now this branch is posterior superior alveolar nerve, and one more branch it gives, that is a zygomatic branch. Now zygomatic branch also passes through. Now this is zygomatic branch. I'm writing as zygomatic. So while passing the pterygopalatine fossa, it gives two branches, zygomatic branch and posterior superior alveolar nerve. Okay, right. Now zygomatic branch, which is divided into zygomaticofacial and zygomaticotemporal. Zygomaticotemporal and zygomaticofacial. Now this zygomaticotemporal, which joins with lacrimal nerve and in turn supplies the lacrimal gland. We see that while discussing the parasympathetic ganglion, we discuss how the zygomaticotemporal nerve joins with the lacrimal nerve and supplies the lacrimal gland. Okay, right. And what about the posterior superior alveolar nerve? Posterior superior alveolar nerve, which supplies the upper jaw molar tooth. Which supplies upper jaw molar. Right. Now, what are the branches from the infraorbital nerve? So, infraorbital nerve, which gives middle superior alveolar and the anterior superior alveolar. Okay, this is middle superior alveolar and anterior superior alveolar. Okay, so middle superior alveolar is the branch of infraorbital nerve. Again, please remember, one time in AIMS exam, they gave this question. Now, what are the branches coming from infraorbital nerve? So, infraorbital nerve means middle superior alveolar, anterior superior alveolar, coming from the infraorbital nerve. Posterior superior alveolar nerve is not a branch of infraorbital nerve. There is a branch of maxillary nerve. That is the point. So, posterior superior alveolar, branch of maxillary nerve. So, middle superior alveolar and the anterior superior alveolar, they are the branches of infraorbital nerve. Infraorbital nerve, continuation of maxillary nerve only. But in the exam, they ask you specifically, which of the following is a branch from infraorbital nerve. One time they gave this in the AIMS exam, again more chances to repeat in the INCT exam. So middle superior alveolar, anterior superior alveolar, they are going to supply the upper jaw, premolar, middle superior alveolar. Anterior superior alveolar supplies the upper jaw, incisor tooth and the canine tooth. Upper jaw, incisor and the canine. Now these three, posterior superior alveolar, middle superior alveolar and anterior superior alveolar, now these three branches, they unite and they supply the maxillary sinus. So maxillary sinus is supplied by these three branches, posterior superior alveolar, middle superior alveolar, anterior superior alveolar. Maxillary nerve supplies the maxillary sinus. Everybody knows that. Now in the exam, they ask you specifically, posterior superior alveolar, middle superior alveolar and the anterior superior alveolar, they're going to supply the maxillary sinus. Okay, right. Now that's all about the maxillary nerve. Now we see the diagram. Right. See the diagram. Now this is the trigeminal ganglion. Okay. Now the trigeminal ganglion, yes, giving three divisions: ophthalmic, maxillary, and mandibular. Now the maxillary nerve, which passes through this opening. Can you see this opening here? That is our foramen rotundum, and it enters the pterygopalatine fossa. Now this is our pterygopalatine fossa. Pterygopalatine fossa. Now the pterygopalatine fossa, it suspends one ganglion here. Can you see the ganglion? Yes, pterygopalatine ganglion. Okay, and then it leaves the fossa through inferior orbital fissure and enters the floor of the orbit. This is our infraorbital canal. That is infraorbital canal. So the name of the nerve changed to infraorbital nerve. And infraorbital nerve comes out of infraorbital foramen. Yes. And finally, giving the three terminal branches. Now this branch is called a palpable branch. I'm writing as P. And these branches are nasal branch. And this branch is labial branch. Okay. Now see the branches. Now this is our posterior, superior alveolar nerve. And this is middle superior alveolar. I'm writing only as M. And this is anterior superior alveolar. Okay. Right. And see these branches. These branches, they encircle and they supply the which sinus? Maxillary. That's a maxillary sinus. Okay. They're going to supply the maxillary sinus. And see one more branch. This is the zygomatic branch. I'm writing as Z here. Zygomatic branch. A zygomatic branch divided into this is zygomatico-temporal and the zygomatico-facial. Now zygomatico-temporal joins with lacrimal nerve and in turn supplies the lacrimal gland. Okay, right. So that's all about the course of the maxillary nerve, course and branch of maxillary nerve. Okay, right. So now we're going to discuss about the pterygopalatine ganglion. I told you already, the pterygopalatine ganglion is the largest parasympathetic ganglion. Okay, now as usual, we're going to discuss any ganglion in these four headings only: topographically, anatomically, the pterygopalatine ganglion attached to which nerve? Maxillary nerve. But functionally attached to facial nerve. Functionally attached to facial nerve. Now, what are the glands supplied by the pterygopalatine ganglion? What are the muscles supplied by pterygopalatine ganglion? This ganglion supplies only glands, concerned with the secretion from glands only. So it supplies lacrimal gland, nasal gland, and the palatal glands. Okay, right. Now we're going to trace the pathway. Now we're going to start from the lacrimetric nucleus. So we're going to trace the pathway from the lacrimetric nucleus. The lacrimetric nucleus is nothing but it is a caudal part of superior salivatory nucleus. Caudal part of superior salivatory nucleus. Now from the lacrimetric nucleus, the fibers are given to nervi intermedius. Nervi intermedius, which is also known as the nerve of Rysberg. Okay. Now from the nervi intermedius, the fibers are given to the trunk of the facial nerve. So from the facial nerve, the fibers are given to geniculate ganglion. From there, fibers are given to greater petrosal nerve. Now from the greater petrosal nerve joins with deep petrosal nerve to form Vidian nerve, and Vidian nerve, which in turn joins with pterygopalatine ganglion. Okay. Now the pterygopalatine ganglion, yes. From the maxillary nerve, we have zygomatic nerve. So pterygopalatine ganglion is suspended by maxillary nerve, the pterygopalatine fossa. Now the maxillary nerve is giving zygomatic branch. Now the zygomatic branch and then zygomatico-temporal zygomaticotemporal. Now, zygomaticotemporal branch, which joins with lacrimal nerve, which in turn supply the lacrimal gland. Okay, and the greater palatine nerve, and then to lesser palatine nerve, which in turn supplies palatine glands. Right, and the nasal branch, via nasal branch, it supplies the nasal glands. Okay, yes, this is the pathway, the parasympathetic pathway for this ganglion. Okay, right. So that's all about the pterygopalatine ganglion. Again, don't worry about these nerves branches. While discussing about the facial nerve, you get some clear idea about the pathway, the nerves and structures involved. Okay, so just remember this. Okay, again, we'll discuss the same structures in the facial nerve topic. So now one more content we have. There's a maxillary artery. Also the content of the third part of maxillary artery is a content of the pterygopalatine fossa. So now we're going to discuss about the maxillary artery. So maxillary artery, yes, heading. So maxillary artery, yes, it is a terminal branch of external carotid. Terminal branch of external carotid artery. Okay. And the maxillary artery is divided into three parts by means of the muscle. Which muscle? Lateral pterygoid muscle. So this is the maxillary artery. This is external carotid. The external carotid is giving the terminal branch, the two terminal branch. Now this is superficial temporal. And this is maxillary. And this is external carotid artery. Okay. So the maxillary artery is divided into three parts by means of lateral pterygoid muscle. So this is the lateral pterygoid muscle. Okay. So now we have three parts of the maxillary artery. Okay. So this is our lateral pterygoid muscle. So now the maxillary artery, it is divided into three parts by lateral pterygoid muscle. This is the first part, the second part, and this is the third part. Now the first part of maxillary artery, okay, it is called mandibular part. The first part of maxillary artery is called mandibular part. So mandibular part extending from the origin up to the lateral pterygoid muscle. Okay. Now second part. The second part of maxillary artery, it is called pterygoid part. The second part of maxillary artery is called the pterygoid part. The pterygoid part is present over lateral pterygoid muscle. Now third part, pterygopalatine part. Pterygopalatine part. The pterygopalatine part, which is present in the same fossa. Present in the same fossa. Okay. Right. So these are the three parts of maxillary artery. Fine. Next. Now the first part and the third part, they require the bony foramens to pass through. First and third part of maxillary artery, they require foramens, bony foramens to pass through. What about the second part? The second part of maxillary artery, it is giving only muscular branches. So does not require any bony foramens to pass through. So second part, please write, which gives muscular branches. Which gives only muscular branches. Okay. Right. So these are the three parts and some basic idea about the three parts. So next we're going to add branches. What are the branches coming from first part, second part and third part? So the first part of maxillary artery, which gives 5 branches. Okay. Number 1, middle meningeal artery. Number 1, middle meningeal artery. Number 2, accessory middle meningeal artery. Accessory middle meningeal artery. Number 3, deep auricular artery. Number 4, anterior tympanic artery. Anterior tympanic. And last one, inferior alveolar artery. Inferior alveolar artery. So the mnemonic is Made, MAAID, made or maida, anything you can remember. But the point is, you have to remember the branches from the first part. See, in the exam, they'll ask you specifically, all the following are branches from third part except which of the following is a branch from the first part. So likewise, they ask you the question specifically. So you have to remember the branches from first part, second part, and third part. So first part, we have mnemonic. Mnemonic is made, MAAID or MAIDA, maida. Okay, right. Next one, the second part. So second part gives motor branches to the muscular branches. Number one, deep temporal branch, mesenteric branch, pterygoid branch, and the buccal branch, buccal artery. Okay, right. So from the third part, we have 6 branches. Third part present in the pterygopalatine fossa. So number one, posterior superior alveolar artery. Number two, infraorbital artery. Number three, greater palatine artery. Okay, and then pharyngeal artery, artery to pterygoid canal, and last one, sphenopalatine artery. So again, we have a mnemonic, again very old mnemonic. The mnemonic is PIG, pig, PAS, pig pass is a mnemonic. So mnemonic, to remember the branches from third part is pig pass, PIG, PAS, pig pass. Posterior superior alveolar artery, infraorbital artery, tetrapalatine artery, pig, pass, PAS, pharyngeal artery, artery to pterygoid canal, and the sphenopalatine artery. Okay, it's very old mnemonic. Right, now see the diagram. Now this is the maxillary artery, and the maxillary artery is having 3 parts. Now this is the first part of the artery, and second part of the artery is present over the muscle, and the third part of the artery in the pterygopalatine fossa. Again, this muscle is our lateral pterygoid muscle. Now see the branches from the first part: middle meningeal artery, accessory middle meningeal artery, inferior alveolar artery, anterior tympanic artery, and this is the deep auricular artery. That one is deep auricular. Now second part, the second part is giving pterygoid branch, okay, and then deep temporal branch, and then buccal branch, and then mesenteric branch here. Right, now from the third part, see here, the posterior superior alveolar artery, infraorbital artery, greater palatine and descending palatine artery. Okay, and then pharyngeal artery, artery to pterygoid canal, and the sphenopalatine artery. Okay, these are all the branches from the maxillary artery. Okay, so by this, yes, we are completing the sphenopalatine fossa and its contents. So first we discuss the boundaries, and then we discuss the communications of the sphenopalatine fossa, and we discuss the 3 contents: maxillary nerve, pterygopalatine ganglion, and the maxillary artery. Okay, right. So that's all about the pterygopalatine fossa.